Okay, the Minnesota Hoarding Task Force welcomes Lauren Ross from Ramsey County Housecalls program.
You, please ask questions. If you have questions that come up, interrupt me because I don't have a planned speech. I don't have a PowerPoint. Again, I've been working at Housecalls for 10 years, and a big part of the work that we do and the reputation that we have is that we do help people who are on the verge of homelessness, and with some assistance could prevent that. And we collect resources, advocate for resources, and help people sort through those issues so that they can prevent the loss of their housing. In Ramsey County, every year, that equates to about 50 households, which is really just a drop in the bucket. Most of those referrals are coming from a few different places. Some of you may be familiar with Ramsey County Environmental Health, where they investigate and look into public health nuisances. Maybe you've worked with or had Lori Green as somebody. So environmental health is a big support to the Housecalls program. They are part of our ability to get roll-offs or dumpsters in cases where there's cleanouts, which makes any kind of cleanup situation a lot more affordable for a resident. So environmental health, if they get a public health nuisance request to go out in the community, many times they will ask Housecalls to accompany them for that case management piece. The other part is probably the Department of Safety and Inspections in the city of St. Paul. We call them DSI, but they're the local community inspectors who are going out. There's rentals and non-rentals, so you have fire inspectors and regular house inspectors, and they're going in and looking at concerns. And if they come up with orders, there's sometimes give us a call, or sometimes those community members will call themselves and ask for the support to address the orders that they're receiving from DSI. Those are our big referral places. Kind of the next level would be community family members who are aware of Housecalls. We have a small brochure, we're on the Ramsey County Public Health website. So people just may know of us because maybe a neighbor got help or somebody else got help. But certainly we get some people that just call. There are also the mental health case managers. Protection is certainly somebody that we partner with very often, along with child protection cases, all where the school has vulnerable family members who are losing their housing because of the condition of the situation. There's many calls that we may not get involved with because maybe it requires more resources, or perhaps it's not something that the individual wants the assistance with. All the work that Housecalls does is voluntary. We're not a mandatory service. So even if they have correction orders, they have the ability to choose how they're going to manage their cleanup, and we'll support them with resources and information of who we may know. We will also support them with just the dumpsters if they want the dumpsters alone. They may have family or friends, or they may not be in a position that they want to have the discussion, but there's certainly a number of situations where we're not able to help because it's something that they're not looking for help with. Or maybe we hear from them a few months down the road when maybe the orders get a little more strict with the city. And that can be like with a municipality or suburbs. Anywhere in Ramsey County, we're willing to open a case and help people from the beginning to the end get through housing crisis. So an example of a real standard housing crisis that we see in Ramsey County. I'll talk about one that we just opened. It's a call from the McDonough Housing, which is public housing in the city of St. Paul. And they have a family who is living in public housing, and they're not passing their housing inspection reports. So it's been 3 missed housing inspections. There's a number of things on their checklist that haven't been done from the family. McDonough has reached out to Housecalls saying this family is on the verge of getting evicted if they don't get the help. And if you open this, we will delay filing an eviction. So that's a really important referral, because we know that that's a family receiving a subsidy to actually provide that housing. So in the case of a loss of housing, it'd be very difficult to get that affordable housing back for the family. I would say that public housing and not passing inspection is about 30% of the work that Housecalls does. So sometimes it's a family, sometimes it's just an individual, and most of those times I feel like we do get the cooperation of that person. I would also say that we'll see them back in 18 months or 2 years, and that's difficult because most of the time when we're exiting, they do have some kind of services. Adult protection is maybe open, or child protection may be open, and services are identified, but maybe they don't follow through. Or sometimes they get the services, and for whatever reason, that service provider is dropped off over time. Never got reconnected to another one. But we are happy to jump back in, even if they've gotten those services, and provide the care, follow up, because we know that that's probably our most vulnerable population in Ramsey County, are the people living in public housing needing help. Would I describe them as hoarding as much as I would say maybe higher fire load accumulation for a variety of reasons? Everything from somebody who's pulling in 3 bikes off the street and just filling their room. And we even help residents who are at the charities, higher ground, and they have just a tiny room, but they can get evicted too. So we'll help in those situations to kind of clean that out and prevent them from actually being evicted from a homeless shelter, to larger circumstances where it's people that may have a lot more resources, and for whatever reason, most typically a medical reason, they've gotten behind on their ability to keep up with daily hygiene, daily chores, getting the Amazon boxes out. So the next group of folks that I would say that we work with are individuals struggling with their mental health, living in the community, times and housing situations maybe that they didn't initiate. Maybe they inherited a home, a parent or an aunt or somebody in their family has passed along. Somebody who was a primary caregiver of them has passed on, and suddenly they're given a lot of responsibilities, and they don't have the supports that they need, and their household has become at risk because of that. So that's another large group that we see, and there's a whole variety of whether they have resources or don't have resources and how much we can help, because the size and the amount of what it will cost to address those situations can vary. If we go in and we have a situation that is, beyond public housing, we always get an estimate, and I'm sure you guys are familiar with the 2 companies that Housecalls uses, which are Variant Enterprises.
Yeah, they spoke to us in the summer. I don't remember if it was this summer or last.
Yeah. They're like family to Housecalls. We've worked with them even more than 15 years, like a long time. Housecalls and Baron Enterprises that used to be domestic engineering. We've had a connection and a relationship, and they've been a primary like contractor of ours. They're a 1099, and the prices, like when I started in 10 years ago, we could go in and help a household for $500 or $600. Now, 10 years later, it looks like you can't touch a situation for under $1,500, $2,000. So there's been a big change over the last 10 years, but we've continued to use Baron, also use Craig Swalcheck from Quick Turn. And out of that, I would say there might be 1% where we may find a way to pay for a cleanup that isn't within those two contractors, but I think the advantage that we've come to is that they understand all of our dumpster rules with waste management, because we can only use waste management. And we've partnered for so long, we understand as a business how they work, and they understand as case managers, maybe the populations that we're serving. And so, if they need help in that process, they can connect with us so that we can have a success. And both companies, I believe, work well with individuals that are vulnerable with their mental health or their medical needs, and they're patient in that process. There can always be complaints and concerns, and cleanups are never easy and often not the most smooth, but sometimes they're really incredible. And I appreciate both of those teams and the work that they do, because I say a lot of them can be described as gross and unsanitary conditions that we're sending folks into, and not all contractors will go into that. So our goal is always to share orders and have copies of whether it's the public health nuisance order or the DSI correction order, and work with that household member to make sure that all those major correction points get met. Some of the biggest barriers to that would be the times where maybe there's electrical work or plumbing work, maybe even a structural situation with a handrail or other things where we feel like we can't meet all of the pieces of that, and we have to call around and try to get the contractors to come in and do the extra things. And that's certainly very difficult because we're not paying them directly, and the resident has to do the follow-up, and they have the ultimate decision on who they're hiring and what they're doing. So there's a lot that the resident is ultimately responsible for beyond the sanitation. And we try to partner the best that we can to get through that. You guys want to ask me any questions?
Do you have a list of contractors that we can possibly choose from?
The City of St. Paul Home Loan Program used to be a program that we would work with, and we would do an application and have some of our residents waiting to get some funding through there, and they had a contractors list. We've certainly used that contractors list, but however, since COVID, I don't think we've had one family that's gone through and actually gotten any answers from City of St. Paul Home Loan. It's technically closed for new referrals, so I don't know what that means. I don't think that they're closed, but maybe they had gotten just so many during COVID, and they haven't even now haven't caught up with what they're doing. So there's been a changeover over the last few years at the City of St. Paul Home Loan Program. So I don't have any great updates about that. That's where our list came from. Next layer is both the contractors, Baron and Craig Swalcheck. They have their favorite. They have their favorite HVAC, carpet cleaning groups, and we may ask each of them can you coordinate with that group if that's an issue on one of their meetups? And both companies very good at communicating. And again, the goal is always to get to where the inspector's going to be happy and pass them so that they're no longer.
I remember one situation that I just had information on, didn't see anything. The person was so anxious that they didn't answer their phone. They didn't come to the door. And things got worse and worse for them, of course, because they weren't reacting to the help that was being offered. I'm wondering if you ever do like a sign off where you could call the friend instead. Would you ever allow that? Where they, like if they signed a release, could you call the friend to get them organized, to take phone calls, to be ready at the door at the right time? That kind of thing.
There's so many situations where you start off and the resident is actually hospitalized. Sure, it started because of a 911 call.
Right.
They were taken to the hospital and maybe they have to spend a certain amount of time in rehab. And so both myself or either of the crews have gone and gotten releases, gotten keys, talked to neighbors and figured out like who's going to let you in and on what day and what's that going to look like. That happens often just because of the population and how often they may not be able to be home, whether they're condemned out of their home, right, or just kind of pending being able to get back in because of a medical barrier, which is so common.
What's the average time for the cleanup?
If people are agreeable, I don't think it takes more than 10 days from the initial call to get the estimate and then secure the funding and get the work done. Both crews may go in and out of vacation or have something going on, but one or the other is typically available. And when you're talking about 50 in a whole year, that means, between 3 and 5 a month for our house call social work staff. That's not the bulk of our work that we actually do at house calls. So we certainly are able to move that along because we don't have an excessive amount of sanitation referrals that we're working on at any given time.
What's the bulk of the work? What takes up your most time?
What takes up the majority of my time as the social work supervisor, I'm a working supervisor, so I have as much work as anybody on the team. And those FHPAP dollars, federal homeless and prevention dollars that are coming in to help pay for sanitation, they also come in to help pay for rental eviction. And they also come in to pay for utility prevention for disconnection. So we have staff that sit in Ramsey County eviction court on Wednesday. For instance, just on Christmas Eve, New Year's Eve, I think we sat in on 10 separate cases. Each of those cases may represent anywhere from $1,000 to $10,000 of how much they need to prevent them from losing their home because they're behind on rent. So much information to collect on a rental emergency that takes up the bulk of our time. For instance, last year, house calls probably assisted with $400,000 worth of eviction prevention funding directly to community members. That's that are getting anywhere from $200 to $3,000 directly paid to their landlord, guaranteed, getting them to a zero and out of this. That's the bulk of our work. It was not the bulk of our work before COVID, but really has become much more of a demand since COVID. the amount of people that are in housing court has had to kind of double their days and their times. They've had to add extra staff just to process the number of evictions. So preventing people from homelessness is our priority. And you see that in different circumstances. And budget for helping with sanitations, it's probably 50,000 or less. It's not very much. And
For the year?
for the year. Yeah, it's very limited, but if you look at, we can do up to 3 roll-offs. Say one roll-off is worth $700 or $800. So maybe that's a $2,400 savings that we don't even have to kind of calculate into the monies that we may help with the crew who trying to do the hands and feet of the work. So we'll coordinate and case manage the effort to get the lowest price that we can for the situation. Sometimes people have to pay a portion. So sometimes people are able to pay a portion and they'll start by doing the work themselves, and it may delay what's happening, but then it's less time for the crew and it becomes more affordable. So each situation is pretty unique.
And I think I've heard of some people, if you're a homeowner, being assessed or getting an assessment on their house if they weren't paying, if they weren't able to pay. Is that still true, or is that old news?
Like just a week ago, young mother who has health challenges, cognitive disabilities, and her mom is a social worker who's retired at the city of St. Paul. This client allows a lot of different homeless folks to come and go from a home that she owns, it's a small home in St. Paul, and she ton of trash on the exterior of her home. So lots of reports from the city came in, lots of concerns, and even though we were willing to give her dumpsters, they weren't doing the work to put the stuff in the dumpsters. So DSI had to come out and abate it. So that abatement, yes, that goes on her taxes. If that inspector has to keep coming out and keep getting calls from the community, they have a price that they'll put on that, like $150 to $200, and they will tell the person, they will send them the bill and show them we're charging you for excessive consumption of our services. So that happens. Jamie's doing. Yeah.
I had a question in relation to the example you gave about the utilities and the rent example. Is there an average age that you're seeing in those situations, or is it all over the place?
What I can tell you is that the majority of the people that are served in house calls, children. 3/4 of the people that we serve are children. They're children of single moms. They're children of single moms of color. So they're single moms between the ages of 15, 16, all the way up to whatever age. They're grandmas and they're single parents. There's plenty of single adults who also will meet all the criteria for rental assistance, but by and large, it's people that are single parents. We are excited that the Community Sharing Fund now, as of 2025, is willing to partner with the community for single adults, because there's definitely a demand for single adults who maybe it's their job unexpectedly, or they got sick and they didn't have the PTO, fired, and they don't qualify for unemployment, had to stop working to take care of a family member. There's so many scenarios. Again, the medical scenarios, had to have surgery, got a diagnosis of cancer, That is so common in like the 40 to 60 age group, that there's some kind of medical situation and there's not a safety net that they have. So financially, they've gone through their resources quickly and they're looking for help to sustain for rent. And that's hard because, you know, we help. Our average rental assistance is about $1,500. We can only help one time a year. We're not emergency assistance, and we can bundle with emergency assistance, but it's limited. It's not going to continue to pay your rent if you have to be out for 6 months, and you can't work for 6 months. So it's a Band-Aid at the best, and it's a sea of requests. We get approximately 450 calls per month into household calls as people say, you know, I'm on the brink of homelessness. I've gotten an eviction letter. I need help. A lot of calls. Month is done, and I look at what my staff have been able to provide within our boundaries and our limits. We've helped maybe 30 households. 450 people call. So there's a lot of folks that still have to go out and figure it out. So we're not the end of the line for most of those situations. We're small and we're part of helping, but it doesn't feel like it helps.
Oh. And Louise, you raise your hand.
Super demanding.
Thank you.
Oh, you're muted though. Louise, you're muted.
Thank you. Yeah, I turned on the camera, but not the other. Thanks. I was curious about the people you interact with, whether rental or homeowner residents. What proportion of those folks, if any, are on some type of a waiver, or someone within the family, perhaps on a waiver?
Not many. Oftentimes, for instance, the young woman with cognitive issues that just had her yard abated by the city of St. Paul and it went on her taxes, she had waivered services. Her children had waivered services more than a year ago. There was a problem with the paperwork. There was a problem with her medical assistance running out, and one to get her services back up and running. And if she doesn't provide the verifications and documents to me, I'm at a loss too of how to get those services back. We see a lot of people who have lost those services because if they've got those services, I'm probably not going to hear from them. They're going to get that help, and that crisis will get resolved before it even gets to us. Sometimes somebody will have a waiver. It's just not often. Something in the last year and a half, 2 years that has been really amazing is adult protection has money. So beyond waiver, which waivers are great, but there's a pot of money that adult protection is able to get for emergencies to help with crises, that helps in similar ways that waivers have helped, and can help in a variety of things, whether it's a cleanup for, we want to talk about bed bugs, but you know, whether it's bugs or for a sanitation issue or whatever kind of situation somebody has gotten into and they're considered a vulnerable adult. That's been great to do some partnering with adult protection because our funds are very limited. So being able to bundle or braid with another partner usually gets the situation addressed in a more longer term way. So to answer it, it's not a lot of folks are coming to us with favorite services. A lot of people have lost their medical assistance and are confused on how to get it back, when they're going to get it back, or they've done a lot to try to get it back and it's just at a stop gate. I just hired a social worker in for Housecalls in November, and she worked as a navigator in Ramsey County Enterprise Services, which so with all those calls for things about what do I do, how do I get my medical assistance, X, Y, or Z, and literally there's just a minimal number of staff, and doing those MA applications, and they're so many months behind. It's not even, I shouldn't even talk about it out loud. I mean, it's just very hard. So,
If you had a magic wand, what would it do?
when people have their medical assistants back on, then they can request to go to another facility, or they can get the services referred for what they want. But when their medical assistance is stopped, you're kind of at a huge pause. So haven't seen this before. Like in the last 10 years, this is the first time this past year of seeing medical assistants kind of,
We're seeing it too, so,
yeah,
for sure.
it because then you're kind of can't do very much, right? Because
So
you can't
just-
get the speed for it.
I could shed some light on that. You may be recalling that everybody with medical assistance after COVID was ended had to reapply for their medical assistance. And anybody who's worked with anybody through those processes know it is really difficult for a college educated, intelligent person to do all the paperwork. So when you lop that onto somebody who has perhaps physical and mental disability and or other divergence, that can just be overwhelming to the point where that it just doesn't get done. So I think that's what you're seeing is all those people who just didn't either understand they had to do it or didn't know how to do it and couldn't do it. But hopefully that'll get solved.
The caseloads are too big for the number of
Yeah.
local workers. The turnover is too high. It's an extremely challenging situation. I don't know what the options are, but there's some people that are obviously going to be on medical assistance for the rest of their lives, and I wish there was a more streamlined way to identify those folks and keep some parts more permanent. Because I understand that you have to report your income, and that's fair, but could the utilities just automatically report those? Could you sign off on that so you don't have to go get your own copies of your utility reports, et cetera? I don't know what the answers are, but it's really challenging.
Yeah, even I have clients that are hospitalized, and they'll have their social workers in the hospital help them reapply for medical assistance. And you would think of anybody helping, those folks would know exactly what they're doing. And I've seen many of them just get denied. And I'm thinking, whoa, if the social worker at the hospital who's used to doing this like all day, every day, can't get this through, I don't know what's going on. And somebody who's had medical assistance for maybe the past 20 years, now have a gap in it, and we're not able to get it turned back on. It's just like, whoa. It's beyond my scope.
So one other thing I just wanted to throw out to the group to hear, and I don't know how firm this information is, but this came through a client who has been on a CADI waiver, a CDCS, and when they were reevaluated, evidently DHS has now said that those CADI waivers in particular are not going to cover mental health issues, that they're only looking at physical issues. I know, it's kind of crazy.
Wellstone and company took care of that, I thought.
Well, evidently, again,
Goes to court.
it could be because there's a slow moving machine here within the whole social service system between the county, between the agencies that are implementing and so forth. But if that got solved, it's not yet solved on the end with the clients. I can tell you that in the last 4 months, not been solved.
Right.
So that may be something else that could be an issue coming up here. The people who usually had the money, at least for short term, until things get corrected, if they are going to get corrected, may not have the waiver funds that they used to. Because I had a client who had a 75%, more than 75% decline in what the yearly waiver amount was. Very strange. So keep an eye out.
Yeah, and kind of the wave before that with COVID was that people who had the caddy waiver services, they had providers who weren't going into the home because of COVID-19. And so in public housing, and the single adults with mental health, physical health, all of it, that certainly we saw a huge wave of individuals who hadn't gotten services for a year and a half, 2 years plus. And so when we finally got there, it was really quite the situation to get through, and still not at a place where they had the service provider to help them jump in once the place got cleaned up. And that's always the big dilemma. Okay, we're gonna clean up on Thursday. It's gonna be great. We're gonna have 6 staff there, and we're gonna work through all of this, and it's gonna be like a clean start. But there's nobody to come in after that, and finding that support, especially without medical assistance, is a huge barrier.
Mm-hmm.
Huge.
Mm-hmm.
I think we need to have some legislators come to our meeting. Or we go to them this winter, I guess. It's probably, they've already decided their docket. Maybe we just need to get on their docket for next year. Thank you. Do you have anything else you wanted to make sure got in here?
No, we do get so many calls of people that chosen to isolate themselves in their home and don't understand the value of the services that are available that can help, and trying to build the rapport with them and gain the connection. And maybe they've had services before and it didn't go the way they wanted it to go, but we're always looking for better ways to connect and team in with the household, because I would say overwhelmingly people don't just trust us calling back after there's been a referral. And yeah, come into my house and get it all cleaned up.
For sure.
Yeah, so and like the calls from Regions social workers and other like staff social workers in hospitals, those folks hardly ever want us to do anything, and you just have to work really hard to try to gain their confidence. That's probably a place that we struggle the most, is just getting the buy-in, because we do have the funding, and when people say yes, we're able to get it done, because we've got the crews, we've got the roll-offs, we even have cleaning supplies, and we've got the social work staff, and that's a unique combination. We also, the person that I hired for the spot social work staff member now is sitting at the head of Heading Home Ramsey. So if any of you are aware of Heading Home Ramsey, that's a collaborative within Ramsey County where social work staff or case management staff from all over, whether it be school districts, hospitals, cities, whatever, they come together and they share resources. And literally that group puts together, it's like a 144-page book of all kinds of resources and sustainable wage job openings in the community. So I think our connection to resources got a lot stronger with our last hire. We've had a Housecalls brochure, and it's probably 20 pages, all your main Ramsey County stuff. What we've never delved into is the sustainable wage jobs and openings and training programs and the other things that'll help people earn to be able to actually take care of their household. So we're very happy to have Sade Kelly on board, and she also had worked for Housecalls back when I was hired 10 years ago. So Sade taking over Heading Home Ramsey was a big deal for us, because we're just in the middle of knowing all the possible resources, and she updates that book. And we can, it's only, it's free and it's online.
Is
So
there, we
I
we can
sent you a
link to it? Yeah,
link.
we should put that into the public part of it.
And it gets updated all the time.
Is it linked through your website? No.
It's not, it's different. So we have said, yes, please continue doing this role, and Housecalls will support it. It wasn't a Housecalls piece before. So just, you know, as a program, we're trying to grow and learn, and, you know, I think a lot of community members think of us for the sanitation and don't think of us for the rental assistance as much. And honestly, some of that money is going to probably dry up, and we'll have to change more and look different. But I hope we always are able to stay relevant with the cleanup stuff, because there's a huge need for that in the community.
Thank you.
Yeah.
You're welcome. Thank you for coming. It was fabulous to hear from you and your program. And this concludes the January 2nd, 2025 Minnesota Hoarding Task Force Public Education portion of our meeting. Thank you.